Hello everyone, I'm Keena, founder of Heartfelt Valor Incorporated. I have the pleasure of interviewing Miss Amira Pierman today. So let me introduce Miss Amira. Amira is a wife of 20 plus years, mother of 4, ages 25 to 14. And Amira is a heart survivor. Amira,
I am.
yes you are. So Amira, would you mind sharing with us your heart condition?
Yes. Well, I am currently a CHF patient. Originally, I was diagnosed. I had Hodgkin's lymphoma, and Hodgkin's lymphoma is a blood cancer.
Gotcha.
So, 50% of people who have had Hodgkin's lymphoma develop some sort of cardiovascular issue. So, I ended up having my first heart attack when I was 20, a myocardial infarction. I had a stent placed. It was due to a blood clot. Because I had fibroid issues and it was extensive bleeding, and they gave me overdose of birth control, developed the blood clot, and that's how that party started.
Gotcha.
I have a history of DVT, blood clots, and then I started having symptoms of swelling, being unable to lose weight, and it wasn't making sense to me.
Right.
And
all of a sudden,
yeah, and I couldn't figure out what was going on. I was living in Virginia at the time. They couldn't diagnose it, or they did not diagnose it. And then I came up to Florida, or down to Florida, nice and warm, consistently.
Yes.
And it was just, I started having trouble breathing. I started not being able to sleep. And I went to the hospital. I was like, something is wrong. And I found out that I had congestive heart failure. I was in congestive heart failure. And at that time, my EF was 35.
Wow. So let me just say something about the ejection fraction. A normal ejection fraction that you want would be between 50 guys, about 50 and 77, 75, 77.
Okay. So from there, it had improved some, but it wasn't improved enough.
Right.
And so fast forward to September of 2023, I had my second heart attack.
Wow.
So that was last year. I was 41 at the time.
Wow.
So literally 21 years later, I had my second one.
So it's been a journey.
Yes.
How has your cardiovascular situation affected your family life?
Well, I spent a lot of time being in and out of the hospital emergency rooms and things like that. So consistently, I was not able to do and perform normal motherly functions. It also interrupted my work-life balance, because if you have constant doctor's appointments all the time, if you're in and out of the hospital for various reasons, these jobs aren't obligated to keep you. And Florida, especially in Florida, it's an at-will state. They don't even need a reason. A lot of states don't even need a reason anymore. So it became, my whole family, thankfully, has been an awesome support system. My husband has my back. He's been super supportive whenever something's wrong. He's very aware of how I function, when he can tell when I'm feeling sluggish and when it's one of those days for me. So I do have the support with my immediate environment, but because it's a very lonely experience, you don't know many people personally who have the same issues with you, with your heart. So even maybe a month ago, we had a moment where I needed to stop. Sometimes I go on digestive rest. And that's just, I do some liquid fasting or whatever, and that day I chose to be a smoothie day. And he said, well, I'm only going to have one smoothie. And I got so upset. I said, you're going to do it with me all day. And because it is, when you feel like you need to when you're feeling like crap, you want the people to, that they can't feel it like you feel it. But it's just like, dang, I got to do this by myself again. I got to feel this again. But eventually he came together, and he made all kids do it too. So we had a whole smoothie day that day.
Awesome.
So ultimately I was supported. So yeah, my work-life my balance in self with my family
it's been pretty good.
It's been pretty good, but it's been challenges that had to be worked through.
Let's talk about the finances. I know you said it did impact your work, history and everything. So being a family of 6?
Yes.
and having to, I guess, maybe take a hit in your finances because you're not able to work as much. How has that impacted you all?
Well, we've had a lot of ups and downs when it comes to that. There's been a lot of times where we were borrowers before we were lenders, and there's a lot of times where there's more month than money, and there's a lot of times when we don't have we have what we need, but we don't always have that next level need where it's a strong desire. We can't always feel that. We've had to get assistance a few times. We've had to get whether any form of SNAP benefits and things like that. We've had to do all that. It hasn't been an easy financial journey with this because I can't work 100% consistently because of my extensive medical history.
Okay. What has been the most difficult part of this journey, going back 20 years ago to today where we are?
The constant feeling like you got like a bomb, it can go off at any moment. Like that second heart attack blew me. I remember I was just on the phone and I was like, what? And I felt it, and at first I thought it was just my nerve because I have some nerve damage because I had a lung surgery and they hit a lot of nerves, so I had nerve damage. Right. So every once in a while, what a normal person would understand is a muscle spasm. So that's what I always say, it's a muscle spasm. And so I had to get off the phone because I was feeling uncomfortable. And then I had that fire in my chest, and then another pain in my the betrayal. It feels like betrayal. How dare what?
I understand.
How is this even a thing again? And so that in and of itself was I couldn't believe it. And I'm like, oh my God, this can't be happening again. This can't be happening again. And finally, I decided to admit it and call 911. So now I had to deal with just overall the anxiety of it again, the disappointment of it again. I had to take the meds because I negotiated with my family, and it's crazy because I live such a holistic lifestyle in general. I fast regularly. I'm active. I was running a 5K a day. I called it my 5K runway because when you walk up that long street, it feels like you're stomping. So I called it the 5K runway, and I would do a walk run, and it was all I did that morning because I didn't feel right. I didn't go and do that. Because I said, you know what, I'm just going to do a little stretching. And I'm so glad I did that. What if I was on the side of the road when that happened?
Right. Wow.
And so I went from not being able to, I went from being able to talk trash and say, I'm managing this, I can do this. I don't need these meds, because I hated the meds. I hate the way the meds make me feel. I don't need these meds, I can do this, I'm fasting, I'm doing this, and I'm doing that, and I'm consistently a faster. So there's no reason why nutritionally I should be having this problem.
Absolutely.
And so then now I was like, all my friends, everybody that loves me, doctors are like, you promised me that if you had another event that you would take these meds. So now I'm under the side effect part of the meds. So that's what I'm dealing with now with respect to just living with it. The situation is just that the meds is just the difficulty with adjusting, because those symptoms, they have they have meds to support the symptoms, to support the side effects, to support, it's just so much. You mess around and you're taking 10 pills a day.
And I'm glad you pointed that out, that you were doing, you were healthy and you were eating right and you were, practicing health and wellness in a positive manner. I think it's important for us to acknowledge that heart disease, cardiovascular diagnosis, it doesn't have one face to it. It's not always from, a lot of times people say, oh, obesity, or, this person eats bad or drinks alcohol or abuses things. It's not always like that. Some people are born with congenital heart defects. Some people are genetically more dispositioned to it. And some of us are healthy. Some of us are living, holistic lifestyles when we get our diagnosis. So I think it's important that, we let that be known. It's not always something negative that you're doing to have heart disease visit you. The most important thing is to worry about preventive actions to take. And if it should somehow visit you, just to know to do your treatment. And as Amira said, take your medicine, do what you need to do, and continue on your path. So mentally, let's talk about mentally. What are some of the things you do in practice to help stay positive and uplifted during these times?
There are moments, right? There's a lot of ups and downs when it comes to this mentally, but I think, especially with cardiovascular disease, and especially the type of things that I've been through, I've realized that I'm pretty stubborn.
Gotcha.
So, I might go down for a little bit, but I'm always gonna come back up. I'm always gonna be fine. Like I got they got hands, but I got them too. You know what I mean? I got them too. So, I use affirmations. I love affirmations. I like to write affirmations. And right now I'm actually working in the manifestation technique, the 3-6-9 technique.
Yes.
3 in the morning,
Yes.
6 in the afternoon, 9 in the evening. And to me, just even intentionally getting it out that many times a day I love the way that my desires are reprogramming my consciousness. Like I can feel each day, every time I write within the cycle, I feel a little bit better.
Awesome.
And so I definitely don't let myself sit in negative thoughts.
Yes.
Everything always works out for me.
Yes.
Is what really stands for me. And that's actually something that is a part of a rampage by Abraham Hicks.
Yes.
So it's one of my morning rampages.
Right.
And it's everything always works out for me. And I can stand on that because I'm talking about cancer survivor, heart attack survivor. We're talking about the chemotherapy and all that stuff. We're talking about lost babies. We're talking about micro-preemies. We're talking about grief. We're talking about but through all of that, it's always worked out.
Awesome.
So I can stand on that and stand on that in faith with a strong posture and say, no matter how I'm feeling, everything always works out for me. My mother-in-law used to sing hallelujah anyhow.
Okay.
And it's just like those things you just got to think about and remind yourself that no matter, you're still here for a reason.
For a reason.
Everything that you went through, there's no need for survivor's remorse because I went through that a lot because two really important people in my circle passed away, one from a heart attack and one from DVT.
Right.
I survived several DVTs and 2 heart attacks. How dare I?
That's right. Chin up.
How dare I?
Chin up.
Say that I'm just gonna let this beat me. No. Okay, I gotta take these meds. All right, you got that. But watch me get weaned off.
Okay, watch me win.
Win.